Thank you very much, everyone, for joining our webinar this afternoon on sustainable development and drug policy in West Africa. On behalf of the organizers and co-sponsors, I wish to welcome you all. My name is Maria Goretti Loglo, and I work with the International Drug Policy Consortium, a global network of over 197 NGOs that advocates for drug policy based on health, human rights, and social justice. This webinar is being sponsored by the United Nations Development Programme, the West Africa Commission on Drugs, the Kofi Annan Foundation, and the University of Ghana School of Law. We are deeply grateful to you all for pulling this event together. So before we start today's event, a few housekeeping notes to take note of. This webinar will be recorded, and we are also live on YouTube and Facebook. We will urge all participants to try and ask questions using the chat box if you are joining us from the Zoom. You can also ask questions on the Facebook page that we are live on, as well as YouTube. And so with this webinar, there will be a Q&A session, and we will then open the floor for all panelists after the panelists are done with their various submissions. And also feel free to at least tweet about this program. With that said, we will now move to the main subject matter of the day, that is sustainable development and drug policy in West Africa. And we all know that our current policies are predominantly based on repression and basically attempts to seize drugs, arrest people who use them. And so these strategies have not really been successful in containing the illegal market that we currently are contending with, or nor does it even reduce the harms that are associated with drugs. At best, what we can say is that it has rather worsened the situation other than solving it. So there's at least now a growing consensus that a change of direction is needed in terms of our drug policy approaches by prioritizing health, security, and human rights at the center of this discussion. Today, we are really privileged to be joined by a team of great panelists with varied expertise to lead us in this conversation. And for that, I'm really, really happy that this is happening. And as advocates, we need to really maximize the greater change that we are all yearning for. So to help us with this discussion today, we have Adeolu Adebiyi, who is a commissioner of the West Africa Commission on Drugs, Madam Ayisha Osori, Executive Director of OSIWA. We are also joined by the National Drug Law Enforcement Agency Executive Director from Sierra Leone, Dr. Saha from UNDP, and last but not the least, Professor Kwadwo Appiagyei-Atua, a senior lecturer at the University of Ghana Law School. On this note, I would now like to begin with our first speaker, Mr. Adeolu Adebiyi. He is a member of the West Africa Commission on Drugs, as I earlier indicated, a regional initiative convened by the late Kofi Annan and chaired by the former president of Nigeria. Adeolu is the founding executive director of Youth Rights Nigeria, and he has also facilitated the formation of the West Africa Drug Policy Network, which is a coalition of over 300 civil society organizations in West Africa, which promotes drug policy reform. Adeolu will basically be taking us through the model drug law for West Africa and sustainable development. On that note, I want to invite Mr. Adeolu to take the floor, and he has about 10 minutes to make his submission. Mr. Adeolu, over to you.
Thank you very much, Maria, for the introduction, and thank you to all the panelists and everyone who has been able to in this conversation this afternoon. yes, for me, it is very refreshing to see a day like this that we can discuss drug policy alongside sustainable development. And, for so many of us, you will know what this actually, means. This is because for so long, the narrative and discussion around drugs has always centered on crime and criminality. Of course, this is not just in West Africa, but also globally. So looking at the SDGs as adopted in 2015 by the UN member states, which are global goals that actually reflect what the priority of governments, policymakers, and every stakeholder who are interested in human development should be. It is actually heartwarming to see us having this conversation also within the domain of drug control. We all know that central to the SDGs, which are all interconnected, is the need for poverty reduction, addressing inequality, and promotion of peace and justice. These are central themes within the SDGs. And over the years, we have seen that drug policies and laws equally have the capability to either alleviate or further deepen poverty, inequality, and injustice in our society as well. So this is something that is actually within the same context that we can, have this type of conversation. So therefore, it's very hard and welcoming and to step up the conversation around drug control and sustainable development. First, we all know that a lot of factors contribute to the vulnerability of West Africa to the drug trade. Beyond the geographic positioning of West Africa that provides an operational advantage for drug, trafficking from Europe to, drug trafficking from West Africa to Europe, to North America, and to Asia. We know from history that the drug trade rolled on the weak governance system and economic crisis in the region, to take a foothold in West Africa. I'll give an example. A case in point is the onset of the economic crisis across West Africa from the early 1980s onward. We have clearly documented how the government of the day came up with policies and actions that, in a way, took a huge toll on the livelihood and welfare of individuals and households, which then provided a vital social ground for all manner of vulnerabilities, which also included the entry of drug networks and their activities. There were ready local collaborators and food soldiers within the region who were ready to advance, the drug activity. And since then, we are yet to witness any significant change in the economic fortunes of the region. And I've seen how the drug networks and activities have grown in leaps, and in bounds. So this was one of the reasons why in 2014, the West African Commission on Drugs released its flagship report that drugs are not just in transit in West Africa, but are now being produced within a growing local market for consumption. And its impact is not just on the criminal justice system, but also on governance. We can see the impact on security, we can see the impact on public health infrastructure and development as a whole. But like Maria mentioned in the opening, is unfortunately the response to drugs in West Africa has mostly been reactive, taking on board the use of repression, without looking deeply into the critical development factors that are driving the drug problem. Of course, no thanks partially also to the fact that most development assistance that countries within the region also have been receiving in response to drug control reinforces the narrow view of the focus on the criminal justice system, which is more on stopping the outflow of drug, from the region to Europe, North America, and other parts of the world. So it has always been about, arrest, the seizure, and prosecution. And even if you ask me, if we try and check those who have been at the receiving end of these arrests, the raids, and the prosecution, you will see that most are drug users, local cannabis farmers, the poor and the vulnerable in society, while the big fish are rarely, rarely touched, oftentimes. So having understood the drug problem in West Africa, we know that, look, from the Commission point of view, this is closely linked to development. And we could also see that the current laws within the region are not having the desired effects. So this prompted the need to actually come up with a model drug law that actually, articulate all these issues, put all these factors together, and we developed and launched the model drug law in 2017. So with the model drug law, which actually was launched, this is actually on the web page, which we all can access. And if you look at the document, you will see that this challenge of reactive and repressive drug laws is actually being looked into, and the model drug law is trying to provide a platform for a proactive response to drug control within the region, understanding the root causes, understanding the drivers, and how best to actually respond to the issue. So the model drug law actually provides model legislative provisions and commentary to support and harmonize national drug laws. One of the things that we saw also within the region is that many of the drug laws are varies in their provisions and their recommendation. But we now understanding that drug control response is closely, should be closely linked to development agenda. There are basic principles that we need to be guided by. Of course, the model drug law also was based on the measures required by the 3 UN drug control conventions. It's actually not a kind of deviating from some of the core principles. It's reflected on the UNGAS document, reflected on the Ecowas and the AU commitment, also reflected on the evidence of effectiveness and known best practices. And for each of the provision, we provide the rationale, behind each of the provision. And lastly, I would say, the model drug law actually provides a concrete template of what an ambitious, health-oriented drug law, should look like. So looking beyond just the criminal justice system, which is also important, but looking, having a robust, dialogue or presentation of what the law should be, knowing that, look, this touches on every facet of our society. So, if you look at the document, the time allotted to me will not be enough to look at all the articles and provisions within the law, but there are up to 36 articles covering different topics on classification of substances, parts of search and seizure, arrest and detention, trial detention, the duties of the court, alternative to custody, and access to essential medicine. But permit me to just zero down on maybe 2 or 3 key provisions from the from the document. When for so long we've given within the region, we rarely differentiate between even drug traffickers and those who are drug users. Like I earlier mentioned, most of the arrests that we talk about, they are users. So the model drug law protects and encourage the adoption of harm reduction in West Africa. This is very important. It also promotes alternative to sanctions, including treatment. And it specifies that the treatment decision should be made by qualified health professionals and not the criminal justice system. So we cannot use the criminal justice system to address a public health issue. So there's need to have differentiated services and and response in this regard. And in terms of part of the key provision within the treatment and harm reduction is also that it discourages targeting drug users, drug treatment centers, even harm reduction facilities by law enforcement, and also able to make us realize that when we are talking about access to health, it should be holistic. And we should also look at some of the predisposing factor that is affecting the individual. West Africa has a burgeoning youth population. We are seeing cases of high rate of unemployment. So how do we ensure that there is a balance and understanding how the drivers of the economic and the society development within the region are also affecting or predisposing the youth population even into the use of drug, and also engaging in small scale drug dealings as well. So we need to look at that within that system. Also, within the criminal justice system, there's need to be targeted law enforcement. There's need to to discourage the use of pretrial detention as an alternative in holding people. We've seen in many prisons now, if we do a stock taking, you see many even people for petty drug offenses are in pretrial detention for period of even more than for months, for years, without being tried, which in the first instance they ought not to be there. So it discourages the use of pretrial detention. And another key provision is in respect to proportionality and decriminalization of drug use. We've now seen a lot of evidence that drug use, consumption, possession and acquisition for personal use is now something within the domain of public health. So we need to have the public health expertise. We need to have the social workers who are trained, and then these are people that need to respond within the appropriate institution, and being able to address this issue, and not an issue where an individual who is arrested for smoking a joint is actually locked up for years, and which has not changed anything. So we need to look at decriminalization and the proportionality of sentencing. That needs maybe the need to have a sentencing guideline to be able to ensure that sentencing is appropriate, and it's not it shouldn't be a ground for corruption or corrupt practices to actually fester. And lastly, it's the access to medicine within the healthcare provision. There's need for access to pain medication, which has been over-regulated within the region. And in terms of even drug treatment, we need to expand the options that should be available within the region, and not just, oh, somebody has to be locked up somewhere, or somebody has to, if you don't do it my way, then no other way. So these are some of the key provisions, also allowing health professionals to perform their duties without fear of reprisal. So these are some of the key provisions that we have, within the model drug law. And another key thing, in rounding up because of time, another key thing that the model drug law put forward is for us to understand the multi-sectorality of drug control response. So it is something that we need to expand our coverage, expand the integration of different agencies that has to deal with human development, to be able to bring on board their expertise in responding to these challenges. And also when we are also working with partners outside our countries and outside the region, we need to let them also understand that the drug control response should be multi-sectoral. It should look beyond just the criminal justice system. It should look at what the public health structure is it adequately strengthened to respond. It should look at the drivers. It should look at how people in terms of human development index, the indicators that we need to watch out for, access to even employment, quality education for people within the region. These are some of the things that we need to bring on board, and not the narrow perspective. So in closing, it is refreshing to see that we are beginning to discuss drug control response within the context of sustainable development goals, which is very important. And so we need to move the conversation beyond the rhetoric of just the criminal justice system, and expand the conversation, expand our response as well. And also, we need to recalibrate our indicators beyond the arrest and the seizures that we often celebrate, or rather look at some of the SDG indicators and see how we measure up, in our responses to, to this challenge. So we can access this, document online, the key provisions, and it's able to look at what has been the drivers, the root causes of this challenge within the region, and for us to be able to respond appropriately. Thank you very much.
Thank you so much, Adeolu. I must say that you could not have said it much better than what you have just indicated, much clearer and loudly. Indeed, as a region, we need to cautiously be bold to question our approaches and bring on board interventions that really aligns with development. Thank you so much. Now, so that leads us to the next speaker on our list. She is a lawyer and an international development expert from Nigeria with 18 years of experience in the public and private sectors. She's a recognized fierce advocate of women's rights and gender equality. And so we are privileged to have her here. She will be giving us her perspective from the donor side on drug policy and development in West Africa. On that note, I have the honor to invite Madam Ayisha Osori, who is the Executive Director of OSIWA. Do we have Madam Ayisha in the house? Hello, Madam Ayisha? Okay, so whilst I'm sure she might have dropped off internet issues or technical issues, on that note, let me move to my next speaker until such a time we have Madam Ayisha back online. I have heard this man speak on various certain platforms, and I was like, wow, this is the first I'm really hearing this language from a law enforcement agency. Very progressive in his thoughts, and I'm very, very pleased this afternoon to have in our midst Mr. Abdul Sheku Kargbo, who is the Executive Director of the National Drug Law Enforcement Agency from Sierra Leone. He is also a former army officer and has gained several degrees from various universities. Mr. Kargbo will be sharing with us some experiences and lessons learned from the Sierra Leone situation and how some of the drug policy related barriers some of the barriers that we face in terms of development. So he'll be giving us his perspective on this particular subject matter. On that note, may I call on Mr. Abdul to take over the space.
Thank you very, very much, Maria. Good afternoon from Freetown. As Maria mentioned, I'm Abdul Sheku Kargbo. I don't normally they say a former army officer and progressive. You don't tend to combine the two. Anyway, I'm Executive Director of the National Drug Law Enforcement Agency. Let me start by saying thank you to the West African Commission on Drugs, and other sponsors of this program, especially Isabella, for inviting me actually to this forum. My topic is what are the drug policy barriers? Basically, what are the policy barriers for development, and the experience from Sierra Leone. If I may continue, drug policy in Sierra Leone is founded on two legislative provisions. One is the Pharmacy and Drugs Act, and two is the National Drugs Control Act 2008. I'm quite aware that I've got only 10 minutes, so I'll try to be as succinct as possible. The latter, which is the National Drug Control Act, basically established the agency with the mandate That's the agency I'm heading, with the mandate to control, prevent abuse, stop the trafficking of narcotic drugs, and basically to implement provisions of international drug control conventions. Of course, normally with agencies deal with drugs, there is a tendency for us to normally, you forget about the areas about prevent abuse, even rehabilitation. Normally the emphasis is just normally on enforcement. I'm not saying that's not important, it's actually very critical also. But I think we also should be looking at a more holistic approach in the way the whole issue of drug abuse is dealt with. As I said earlier, the National Drug Control Act 2008 mandates, for example, the agency to control and prevent abuse of narcotic drugs. Part 4 of the Act actually provides for the establishment of treatment and rehabilitation facilities. So there's an enforcement part of it, and also the provision to rehabilitate offenders. But of course, because of the Act, before you can rehabilitate and treat, the individual basically has to be criminalized in the first instance. That's just one of the provisions. Coming to the issue of development, as we all know, the historical trend and practice in a majority of jurisdictions, as far as drug policies are concerned, has focused on discipline and punishment, with priority given to both repressive, security-focused drug control strategies. I mean, this is what most countries that have enacted drug control laws for the past so many years, this was the kind of global system that we inherited, with the exception of very few. And the International Drug Control Framework basically provided very limited recognition of the development-oriented issues. In cases where such consideration is made, the development aspect of drug policy is actually normally subsumed within a security strategy. Unlike the Millennium Development Goals, the Sustainable Development Goals have recognized the problem of illicit drugs and how it hampers sustainable development. I can go through some of the areas. I mean, SDG 1, we're talking about ending poverty. 2, zero hunger, good health, well-being. SDG 4, quality education, and SDG 5, gender equality. SDG 6, clean water. SDG 8, decent work and economic growth. And SDG 10, reduce inequality. For my point, all of this aim to improve the quality of life of those most marginalized in society. For time and the purposes of this presentation, I shall focus on some aspects of some of the SDGs. For this, I need to commend the research undertaken by some of our civil society organizations here. For example, Forwards, they did a policy document titled Harm from Alcohol and Drug Abuse, and also another policy research that was done by the Institute for Drug Control and Human Security titled Counting the Cost. The latter one basically deals with the effect of our present drug laws on youths within the criminal justice system. Although alcohol and drugs are specified in SDG 3, that is to ensure health, lives, and promote well-being for all ages, the associated targets strengthen the prevention and treatment of substance, including narcotic abuse and harmful use of alcohol. SDG 4 is also an area I'm going to look at because it ties down with what some of our own national policies here, which basically deals with quality education. According to it says it ensures inclusive and equitable quality education and promotes lifelong learning opportunities for all. And target 4.1 covers free education, both primary and secondary, and 4.7 deals with education for development and Target 5.2 provides for the elimination of all forms of violence against women and girls in the public and private sectors. Now, as in Sierra Leone, to aim and buttress the achievements of these targets, the new direction government has basically done a document on the Sierra Leone on the medium-term national development 2019 to 2023. And this gives primacy to human capital development. Also, the government's flagship free quality school education program is pursued as an essential vehicle for promoting human capital development so as to achieve goal 2 of the medium-term national development plan, which ties in with the sustainable development goals. The achievements of some of these laudable goals or targets may be undermined by the lopsided emphasis on drug policy in terms of the punitive law enforcement for drug issues, instead of looking at them from a public health perspective. For instance, if I may just go through some of the laws that are provided for in the Act. The law prohibits the possession and use of drugs on any person who, for example, without lawful authority, buys, sells, possesses, or has on his or under authority or control any drug, or uses any drug by smoking, injecting, or administers to any person. For example, committing that offense is liable on conviction to imprisonment of not less than 5 years. I know in Ghana you've reviewed yours, so we are also trying to do the same. Section 7 of the Act sets a time of life imprisonment for anyone convicted of producing or cultivating drugs, including cannabis. The Act also makes provision for a fine, but as most young people who cannot afford to pay fines, imprisonment in most cases is the only option. Despite the best efforts of government to prevent the illicit trade and misuse of conventional drugs, the misuse of drugs and alcohol, especially among our youths and in our communities, has continued to rise. More and more, as fellow Sierra Leoneans are finding creative ways to get high. I mean, apart from the traditional ones we all know, I'm sure it was quite recently in most of on social media that we have some of our youth who are boiling Pampers water to drink to get high. These are some of the provisions. How, despite all what we've done, the research and the data that we have as from different bodies have shown that the punitive nature and the more focus on enforcement has led to us neglecting some of the public health issues. For example, data from the Sierra Leone Psychiatric Teaching Hospital highlights the following. In 2018, 385 persons were admitted, whereas from January to December 2019, 758 persons were presented at the hospital with substance use disorders and drug-induced psychosis. The majority of individuals that presented with substance use disorders or drug-induced psychosis were in the age group of 20 to 39 years. And as we all know, for development purposes, these are society's most productive cohorts. Cannabis and Kush is basically synthetic cannabis. From the statistics from the hospital, are the most commonly used psychoactive substances, and tramadol is still the most commonly abused opioid here. Research done by Fowles, for example, highlights how the misuse of drugs and alcohol has engendered sexual and gender-based violence that may lead to early pregnancy and marriage. Also, alcohol and drug abuse has led to violence in schools. It has led to juvenile delinquency. It has led to the rise of cliques and mental health problems among even primary and secondary school kids, thus leading our kids and youth to not realizing their full potential. And if our young fail to realize their full potential, then this might actually affect our development efforts going forward. In terms of the criminal justice system, a study done by IDCHS highlights the fact that young adults from poor neighborhoods who use drugs, I think this was also mentioned by my colleague from, by one of my panelists from the West African Commission that young adults from poor neighborhoods who use drugs are more likely to be incarcerated within our prison system, and the attendant ramifications that entails in terms of a blighted future. On that note, these are some of the areas whereby the public health and some of the more holistic areas that we need to look into. On that note, the agency and its advisory board is committed to review the present National Drugs Control Act 2008 and its strategic plan so that it will holistically cover areas dealing with prevention, enforcement, treatment, rehabilitation, international cooperation. This is so that our national drug policy complements and not be a barrier to the attainment of the Sustainable Development Goals, our National Development Plan, and the government's flagship programs of human capital development and free quality education. I thank you very much. I've been brief, and I wish everyone a constructive day. Thank you very much.
Thank you very much, Mr. Kargbo. And permit me to just highlight a few things you've mentioned. The fact that the current response limits the ability of governments to respond to the developmental issues that arises. And so, of course, there is need for a change in direction with our current policies. Before we move to our next speaker, let me announce that those watching us from Facebook, YouTube, and those joining us via Zoom, kindly put your questions in the chat, and at the end of the session, we will be taking the questions up for our panelists to respond to them. With that much ado, we now move to our next speaker. He is a senior lecturer at the University of Ghana Law School, where he teaches public international law, environmental law, and international human rights law. He's currently a Marie Curie International Fellow at the University of Lincoln in the United States, in the United Kingdom, and has served as a consultant for a number of NGOs, including the International Center for Transitional Justice. Prof will be sharing with us some experience from his country, Ghana, on the impact of drug policy reform and human development. On that note, let me welcome Prof. Prof, you have the floor now.
Thank you very much, Maria Goretti, and good afternoon to everybody. And thank you also to the sponsors for giving me the platform to contribute to the discussion. University of Ghana is happy to co-host this program. And the topic that has been given me, which I would want to do justice to it within the time frame I've been given, is drug policy reform and human development, the Ghanaian case. So I'll quickly go take a look at drug policy reform, what it is, human development, what it is, and then look at application of the prohibitionist approach, which Ghana has adopted and applied since a long time ago, and end up with a discussion on the new drug law that we have, the Narcotics Control Commission, to see the extent to which there has been some changes, and finally to look at the impact on the impact of the new law on human development in Ghana. Well, I guess we all know that the prohibitionist approach is saying simply that it has dominated the discourse and practice of drug policies, and it's about prohibiting the use of drugs for personal use or for recreation, except for medicine research and so on. And so with that background, if we're talking about drug policy reform, then we are saying that we want to move away from that prohibitionist approach because it has ended up being ineffectual, counterproductive, and has, in that respect, has failed, because it has led to, in many respects, and more specifically targeting the Ghanaian context, failed to tackle poverty. It has failed to improve access to health for drug users. It has done some damage to the environment, and it has also led to violence among certain groups that engage in the practice, or sometimes between the groups and the police or the law enforcement agencies, including the NACO, that is previously the National Narcotic Controls Board, now the Narcotic Controls Commission. So drug policy reform is to introduce a human rights compliant, evidence-based policies that are influenced by public health concerns in dealing with the drug problem. And so we have issues relating to harm reduction, introduction of harm reduction services, decriminalization, alternative livelihood, and so on. Now, when we talk about human development, it's also about giving people the space to enlarge their freedoms and opportunities and improve their livelihood, so that they're able to develop themselves and therefore contribute to community development. Because without first that self-development, a person will be prohibited from contributing to the development of the community. And in the end, the contribution, if it is not passive at best, it will be negative in terms of actually trying to vent his or her spleen on the society for not giving him or her the opportunity to attain the relevant development for himself or herself. So when we look at the UN system on human development index, it tries to focus on three main areas. That is long and healthy life, knowledge, and decent standard of living. And I'll try and apply these three main dimensions in my analysis of the drug usage in Ghana. As has been in the news and has been highlighted by the West Africa Commission on Drugs and other actors, West Africa is establishing itself strongly as a hub for the transmission and point of contact for drugs, as Adeolu has also highlighted. Unfortunately, the policies by governments have been more of a reactive than a proactive approach. And so the simplest and easiest way is to criminalize usage, and the success of the drug war fight is based on interception of drugs, is based on making dawn soups, parading suspects, burning of marijuana farms, and so on, and having the banner headlines in the news. And then the police will be patting themselves on the back that we are winning the drug war. But in actual fact, there are a lot of unintended consequences which do not support that argument or narrative. in 1990, the government then in power, which was a military government, the PNDC, came up with the Narcotics, Drugs Control, Enforcement and Sanctions Law. And this law was overtly and overly prohibitionist. So that trend has continued. And we had a situation where more funding was focused on security and policing and drug users, about 1 out of 20 or so, could only access treatment facilities. So to give a few examples from this law, cultivation of plants for narcotic purposes, you'll be convicted. If you're convicted, you serve 10 years for that. But there are also problems with lack of proportionality in the sentencing. For example, possession and production, you get minimum of 10 years, but drug use, you will get about 5 years. And then at a certain point, drug offenses were non-bailable offenses. But recently, the Supreme Court of Ghana overturned that law, and saying that it constitutes violation of the rights of drug users, and that bail should be based on each case, but not on the particular alleged offense. There's high risk for drug consumers, especially those who are arrested and incarcerated because of the poor prison conditions that we face. So the number of unintended consequences would have been quite dire for drug users in the country. Stigmatization is also very common, and it goes with discrimination. And the fact that we don't have official rehabilitation centers or centers that are devoted specifically to rehabilitation. We have some few psychiatric institutions, but because it is connected with psychiatric institutions and mental disorders and so on, people who visit these facilities for treatment as drug users are generally categorized as having mental problems, and therefore people don't feel motivated to seek help in that respect. There are some few private rehabilitation centers, but most of them are religious based, and their focus is actually against drug use. And they use strict religious based principles such as fasting and praying and so on, with some of the idea that these people will overcome their drug problem and then become ambassadors to preach for that religious institution in order to bring souls to Christ, to put it that way. There are some who are also chained as a means of trying to exorcise that evil from them and so on. So there are a lot of issues relating to that within the Ghanaian context. Now, with time not on my side, I want to quickly look at the Narcotics Control Commission, a few areas of interest which align with drug policy reform. If you look at the objectives or the objects of the commission, it pays attention to rehabilitation and treatment of persons suffering from substance use disorders, which is a positive, and then also alternative means of livelihood for persons who cultivate narcotic plants. Then harm reduction is also mentioned. And then also recognition of giving, setting up a rehabilitation fund to help in the setting up of rehabilitation centers. However, I must confess that most of these provisions are yet to see the light of day. We may say it's early days yet because the law came into force just this year, I think somewhere March or so, but there has not been much preparatory work on the ground for us to see any efforts to operationalize some of these provisions. Perhaps there could be the reason, good reason that the focus is on COVID. So we are looking forward to next year to see how things will change on the ground. Now, in terms of how this may have an impact on human development, I think already, as I mentioned, there could be the number of abuses ongoing. If we have a rehab center, if we do harm reduction, if we give alternative means of livelihood for those who cultivate particularly cannabis, which is high, whose production is very high in the country, they certainly could promote some improvements in the well-being of drug users, especially those who are problematic drug users. And so the focus should be on ensuring that access to health, right to information and education, those related rights are given key attention. And when these are done, I'm sure it will help improve Ghana's score on the Human Development Index, as well as in realizing a number of the Sustainable Development Goals. For example, Goal 1, which is on eradication of poverty, Goal 3, ensuring healthy lives and promoting well-being, strengthening the prevention and treatment of substance abuse, and so on. So early days yet, but we can look at the law as having some positivities, even though I must end on a note that it still remains, in my opinion, largely influenced by the prohibitionist approach. Thank you very much for the opportunity to do the presentation.
Thank you very much, Prof, for this. And indeed, we need a redirection of the policies to help us achieve the Sustainable Development Goals. And the idea of leaving no one behind can be successfully achieved if indeed we look at drug policy from that lens. So that moves us now to our next speaker. He is coming from the development side, and he will be providing us some perspective in terms of what needs to be done in terms of the approaches. So Dr. Saha leads the UNDP HIV Health and Development Africa team, and he's going to be providing policy programs and strategy, and he supports a lot of the African countries and regional economic entities at the continental level. So Dr. Hassa, at least, I mean, he's going to bring a very experienced perspective as a development agent, because he has been working in this field for almost 10 years now and has more than 30 years experience in the public health and policy programming and delivery. On that note, I want to welcome Dr. Saha to take the floor now.
Thank you, Maria Goretti. I hope everyone can hear me. And good afternoon, colleagues. On behalf of UNDP, I want to begin by thanking you all, and particularly the West Africa Commission on Drugs, the Kofi Annan Foundation, University of Ghana, and Paris Peace Forum Scale-Up Project for organizing this virtual panel on sustainable development drug policy in West Africa. I will briefly try and highlight some of the work that what UN has done, and particularly what UNDP has done to support advances on development, enabling drug policy in this region. The focus primarily will be on people who use drugs and drug policies, and primarily on the people who are affected by it. So unlike ODC or ODC's UN ODC's position, which would be more on looking at the trafficking component, as well as, but I'm more or less going to focus on the development and the human rights and the human aspect of the process, and what UNDP and UNDP as a co-sponsor of UNAIDS has done. I wish to begin my intervention by remembering late Mr. Annan's words when he said that drugs have destroyed many lives, but wrong-headed governmental policies have destroyed many more. And as we have just now heard from our colleague in Ghana and in Sierra Leone previous to that, this still has a lot of truth in it. And Mr. Annan went on to say that I think it's obvious that after 40 years of war on drugs, it has not worked. It is also important at this moment to highlight some numbers, some statistics related to drug use, HIV and co-infections and comorbidities, which affect people globally, but also in our region that we are talking about. UNAIDS in 2020 said that in 218, people who inject drugs accounted for 12% of the worldwide new HIV infections. And UNODC says that injecting drug users, people who inject drugs, are 22 times more likely than the general population to be infected with HIV. So there is, as we have known for the last 30 years, there's very clear, very close, and very direct linkages between people who inject drugs, use drugs, and then particularly people who inject drugs and HIV. In addition, hepatitis C is also highly prevalent among people who inject drugs, with almost half of them, or some 5.6 million people, living with hepatitis C. So half of people who inject drugs also live with hepatitis C. And also a review of available studies found that people who inject drugs in prison had 6 times more the prevalence of HIV and more than 8 times the prevalence of hepatitis C compared with non-injecting prison populations. So as we can see very, very clearly, incarceration is probably the worst thing that can happen to a person who uses drugs, because they may actually go and become infected by HIV or by hepatitis C. A Lancet study in 2017 on HIV and criminalization of drug use among people who inject drugs shows that data confirms what we've already known kind of anecdotally and intuitively, that criminalization of drug use has negative effects on HIV prevention and treatment. And it provided an objective evidence base to support international policy initiatives to reform legal and policy frameworks criminalizing drug use. So it is very, very critical to make these policy reforms as well. As UNAIDS in the 2019 report says, the average prevalence of HIV among people who inject drugs in Western and Central Africa, we are drilling down to our region, has a wide range from more than 9% to about below 3%, but it's the average is about 3.4% if you're looking at the Western Central African countries. However, the more important problematic point here is that size estimates of people who use and people who inject drugs are famously unavailable from most of the government statistics. In context of UNDP's work, in context of health and in the context of sustainable development goals, UNDP's work focuses on leaving no one behind, as Maria Goretti reminded us, and supports the sustainable development goal implementation through policy and program support, data and monitoring, and knowledge production and sharing. UNDP supports partners nationally, regionally, and continentally on reducing inequalities and social exclusion that drive inequity and poor health, promoting effective and inclusive governance for health, and building resilient and sustainable systems for health. So it is reducing inequalities, promoting effective and inclusive governance, and building resilient and sustainable systems for health. As my previous speaker pointed out, Target 3.5 of the SDG Goal 3 specifically speaks of substance abuse and asks agencies to, quote, strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol, and defines the importance of providing prevention treatment services in the context of sustainable development. As UNDP, we support our partners, which could be primarily governments, but also non-governmental organizations and civil society groups in multiple ways, as honest brokers, as co-sponsor of the UN Joint Program on HIV and AIDS, as active participant in other joint efforts by UN bodies like the WHO, UNODC, UNFPA, UNICEF, UNOHCHR, others, in advancing SDGs, through pursuing and advocating for a human rights-based approach, and through supporting national governments, regional entities, and continental bodies in fulfilling their mandates in the context of implementation of the SDGs. We bring together a range of key stakeholders and activists, which include governments, officials, parliamentarians, judges, law enforcement, health and other professionals, as well as civil society actors, and particularly the key population and community activists together on common platforms to dialogue and to look forward for ways forward. For example, UNAIDS and UNDP jointly supported the Global Commission on HIV and the Law from 2010 to 2011. And the Commission produced its landmark report, Risks, Rights and Health in 2012. The report highlighted, and this is a report in 2012, and this is 2020. The report highlighted that the approach to people who use drugs have been predominantly repressive, as we have been hearing throughout the last hour or so of this conversation. And under the aegis of law enforcement, and outlaws individual drug possession and use. It said that these harmful practices do not achieve the purported goals of either crime fighting, or reducing drug use, or drug-related harm, but increased human rights violations against people who use drugs and undermine scientifically proved harm reduction activities. The Commission then went on to recommend citing Portugal's success of decriminalizing possession for personal use, and urged countries to offer harm reduction and voluntary evidence-based treatment for drug dependence. The Global Commission's report has been used and continues to be referred to and quoted in many policy spaces and is accepted as a landmark document. Nevertheless, there is still ways to go in domesticating and implementing the work that the Commission had started. The Commission didn't stop in 2012. They did a follow-up meetings throughout between 2012 and 2018. And in 2018, they sent out a supplementary report which highlighted the progress since 2012. In that, they actually mentioned that there has been a number of countries between 2012 and between 2018 who have decriminalized some aspects of drug possession or drug use. For example, Canada, Colombia, Jamaica, Norway, and Uruguay had decriminalized possession of small amounts of cannabis. And it's very significant that it's not only the global north, but it is also countries from the Latin American continent which has done this. And Jamaica went a step further and expunged the criminal records of low-level drug offenders. So countries with similar histories, similar backgrounds, similar kinds of social and political environments also can do things. It is not as if that because we are in Africa, we cannot. In addition, the supplement focused on core morbidities, especially hepatitis C. And they quoting research, they showed that about 2.5 million people living with HIV are co-infected with HCV. And they cited examples of countries like Portugal, Egypt, France, and Australia, who had made universal access to hepatitis C therapy available at low or at negotiated costs. Again, the Commission recommended that governments must ensure that everyone living with or at risk of acquiring HIV, TB, or viral hepatitis has affordable access to the most effective high-quality health technologies, including diagnostics, medicines, and vaccines for HIV, TB, and viral hepatitis. Again, it is significant to remember that UNDP also continues to support countries which want to negotiate and modify the ways they access and procure drugs and get better pricing or access to generic drugs of high quality through policy and program changes, but also through its Global Fund programs where UNDP is the principal recipient. In March 2019, again, UNDP, that is last year, UNDP was part of a group of UN bodies, experts and national governments that launched the International Guidelines on Human Rights and Drug Policy. That provided a comprehensive set of international legal standards for placing human dignity and sustainable development at the center of member state responses to illicit drug economies. The guidelines cover a set of substantive issues, and not only of drug use and drug possession, but issues that range from development, criminal justice, public health. Of particular significance in the guidelines are the obligations of states parties that arise from human rights standards of right to life, right to highest attainable standard of health, and right to benefit from scientific progress, and of obligations that states parties have towards special groups like children, women, and persons deprived of liberty, and of course, indigenous people. It also significantly highlights the challenges faced by women who use drugs, women in criminal justice systems, and women involved in cultivation of drugs, etc., among others. Again, focusing on livelihoods, the challenges of women have of no livelihoods, going ahead and growing some herb, and then being incarcerated for growing illicit substances, as my colleague from Ghana mentioned earlier on. Within the ambit of the UNAIDS co-sponsorship program, as you know, the UNDP is a founding co-sponsor of the UNAIDS, or the joint program. UNDP is the lead convener and supports programming on human rights, stigma and discrimination, where we focus on legal reform, legal policy reform, access to justice and rights, and elimination of HIV healthcare discrimination. As co-convener with UNDP, we also support HIV prevention among key populations, including MSM, migrants, sex workers, and transgender people. And UNDP also is a partner, co-sponsor partner on harm reduction for people who use drugs and HIV in prisons, for which the lead convener is UNODC. In the context of legal and policy reform and drug use in the work of UNDP, again, to quote the landmark report of the Global Commission, the Commission said in 2012, and I quote, "For people living with HIV, for their families and their communities, for key populations and those vulnerable to HIV, the law is neither abstract nor distant. It is police harassment or clean needles, prison cells or self-help groups. The law is the torturer's fist or the healer's hand." And to follow up on the recommendations of the Commission, UNDP has conducted a range of legal scans and legal assessments, including in West Africa. And based on these recommendations from these law reviews, national governments in countries have undertaken to review their penal and prison codes, national laws criminalizing HIV transmission, laws related to sexual and reproductive health and rights of adolescent girls and young women, and access to evidence-based treatment and care. Access of key and vulnerable populations as well, including of LGBTI populations, prisoners, people who inject drugs, women living with HIV, and other social and justice services. UNDP, as UNDP, we have also supported a convening of African senior judges called the African Regional Judges Forum to sensitize the senior judiciary to current scientific advances, the changing landscape of international jurisprudence, and lived realities faced by people who use and inject drugs, sex workers, transgender people, and so on. Such sensitizations have resulted in significant rights-based jurisprudence that is more science-based and more evidence-based in many, many jurisdictions in sub-Saharan Africa. UNDP has also supported the annual convenings of a African Key Populations Experts Group, which was established in 2014 to advocate for and support the development of regional HIV and SRHS strategies. The group is very, very interesting because it is a pool of experts who are individually members of key population groups, who are either sex workers and who are either sex workers or people who use drugs, and they are selected for their expertise, and they're a dynamic forum. What they have managed to do, and this is where I want to kind of focus on Africa, is that they have formed a series of model regional frameworks for key population programming. These frameworks, one has been adopted for the SADC, and the one very recently by WAHO in Western and Central Africa. So in the context of harm reduction in Africa, these model strategic frameworks have enabled organizations in Uganda to start their own, the organizations in Uganda to start demonstration needle and syringe exchange programs, and have authorized the needs of people who use drugs in the National Strategic Plan for HIV Prevention. And in West Africa, as I just now mentioned, UNDP supported, together with UNAIDS, WH, and UNFPA, the Ecowas and WAHO to finalize the Ecowas regional strategy for HIV, TB, hepatitis B and C, and sexual and reproductive health and rights among key populations. The strategy recommends, yes, I will be finishing in just, this is the last thing that I'm going to say. This strategy recognizes a recommendation to the Dakar Declaration of 2015, and they also highlight the challenges, and some of the challenges were mentioned, particularly in the context of drug use and drug policy, ongoing stigma and discrimination and violence, lack of community empowerment, and regulatory frameworks that continue to use punitive laws and policies such as criminalization of drug use. So I want to therefore end to say that UNDP and UN agencies we continue to support the implementation of rights-based approaches to HIV prevention and treatment for everyone, leaving no one behind using a human rights-based approach that puts the most affected communities, in this context, the people who use drugs, at the center of the response. I want to also finally end that this is a very, very critical time for all of us because of the COVID epidemic that is sweeping across the world and in Africa, which gives us an opportunity, which is a big challenge, but also gives us an opportunity to transform the way we work and push forward more rights-based engagement and make changes in the way we work to provide services and support to people who need them. Unless we do so, we are not only going to not defeat the COVID epidemic, we may also fall behind in providing help to people in tackling the HIV epidemic and the HCV epidemic, and also people who use drugs, among others. I thank you for listening to me.
Thank you very much, Doc. Like you rightly said, UNDP supports right-based approaches. And of course, indeed, if drugs and drug policies cuts across all these sectors, that's the more reason why we need to approach this situation in a multifaceted way so that we can be able to address these challenges. Thank you very much for that. So that now takes us to our last speaker, who is now joined us. She had a few technical challenges and she's now with us right now. So on that note, I will want to now introduce our last speaker, who is a lawyer and an international development expert from Nigeria with 18 years of experience in public and private sector. She's a recognized advocate of women's rights and gender equality. She will be giving us her perspective as a donor on drug policy and development in West Africa. Madam Ayisha, please take over the floor now.
Thank you very much for that introduction, Maria. I hope I can call you Maria. Please call me Ayisha. And I apologize again to everyone for only joining late. I know I've missed a very interesting conversation. And just in this wrap up that I heard, I already heard a buzzword of mine, multifaceted. And I was like, okay, that's great. I think we're all definitely on the same page. Okay, I'm here to speak. I'm also the Executive Director for Open Society Initiative West Africa. And it is in that role that I'll be sharing what OSIWA has been doing on drug policy reform and harm reduction in West Africa for the last 3 years, between 2017 and 2019. So as the introduction said, my intervention would be just sharing a little bit about what we've done, what we've been doing, the lessons we've learned, and what we're looking forward to in the future and as far as this drug policy reform is concerned. So I'll start with a bit of data. So over the last 3 years, ending 2019, OSIWA has spent $2 million working with 14 partners in 7 countries. The 7 countries are Cote d'Ivoire, Ghana, Liberia, Mali, Nigeria, Senegal, and Sierra Leone. Now, when we started, we spent a considerable amount of time and financial and technical resources trying to shape programming on drug policy and harm reduction. And so initially we placed a lot of emphasis on mobilization and empowerment of civil society in this particular reform movement, ensuring that there was increased engagement with national governments. But we soon saw that we needed to complement that strategy with something else. And so we started also looking at support for drug use-led groups, including women who use drugs. We also spent a bit of time on trying to change the narrative around drug use, especially through edutainment tools, to try and tackle 2 things. One is drug user stigma and the negative beliefs, harmful perceptions and beliefs that people have about drug use, most of it which is not true. And then to also provide an opportunity for having conversations about drug use amongst young people at home, schools, just to take that out of the realm of something we don't talk about and something that's completely misunderstood into something that becomes part of national social discourse. And that's what we spent our time doing till date. We have spent 64% of that $2 million on grants supporting capacity building for drug user groups and civil society organizations in those 7 countries. We've also spent 24% of that on trying to change narratives around drug use and drug abuse. We spent 12% of the grants on support for evidence-based research. Some of what we're most proud of, some of the innovations that we've spent our energy on over the last 3 years include a fictional drama, a series in Senegal that was produced called Renaissance. It was produced in French, but dubbed in Wolof, which is the local language in Dakar. And this was broadcast locally and on TV Monde, which is a French television station. We've also supported lots of artists who are engaging with actors who are involved in drug trafficking routes, especially, for example, the Nigeria-Cameroon border, with a partner called Invisible Borders Photography Organization. We've also spent a bit of time on support for social inclusion, especially with the first drug user group for women in Senegal and in Liberia, working with Life Miracle Sisters. And we've also spent, when we're talking about research, we've engaged with University Gaston Berger to try and build Francophone networks and spaces to discuss harm reduction and drug policy. And finally, something else that we're proud of is the work we've done with West Africa Drug Policy Network, the successful passage of the Narcotics Commission Control Bill in Ghana in 2019 last year. So what have we learned from this last 3 years, in addition to the work that we've done with our different partners? Well, we're learning that in terms of progress, 50% of, we're learning that in terms of progress, we are prioritizing the inclusion and participation of people who use drugs in decision-making processes. It really helps to make sure that they're part of the process and there's clear connections are being made between public health and criminal justice reform. You'll be surprised some of the initial conversations that we were having in the early days when we put all the stakeholders together. It was very clear how strongly people viewed the use of drugs as a criminal offense, and even making life for people in civil society who are trying to engage from a public health aspect, putting them at risk sometimes of being running foul of the law. So we've come a long way since then in some of the conversations we're having in some of the countries, such as Senegal, where we've spent quite a bit of time and resources on this issue. The second lesson that we learned over the last 3 years, with implications for how we continue to engage on this topic, is the need for an intersectional approach to drug policy and harm reduction that facilitates women's access to services as well. In many countries, we live in very traditional communities where sometimes even the fact that women are drug users is not something that's easy to determine or easy to accept. And then we've also seen that the use of storytelling and visual tools for advocacy has proven to be quite powerful in terms of challenging the stigmatization of people who use drugs. And then finally, one of the lessons we've learned is that harm reduction services should be set up in communities that they serve, and allow people who use drugs to also have more reliable, safe, and direct access to these services. And we learned these lessons particularly in Côte d'Ivoire and Mali, working with partners Parole Autour de la Santé. So what's next for us? We just want to continue working to challenge the criminalization of people who use drugs through a criminal justice lens. We think that that's a lot of change can come from that. I don't know how many people have made the link between the ongoing conversations on Black Lives Matter in America and the conversations about how Black and brown people get disproportionately harsher sentences for, having drugs or using drugs than white counterparts do. So again, it's the same framing that we're trying to bring here to show that when people use drugs, it's not something that you should be criminalized for, and try to make sure that people who are obviously at the lower economic class, maybe in terms of education, in terms of economics or social mobility, they don't get criminalized for things that other people are also doing recreationally. We're also making sure that we want to set up more women-only groups for people who use drugs. We're supporting that in Senegal, and it's important to see how that can be taken up in other places. So for the future, just to cap, I want to say for 3 things, and this is not just for donors really, it's more for all the stakeholders who are involved in drug policy and harm reduction. we really need to continue to push for a multi-sectoral approach. This is required. We need the health practitioners, we need mental health people, we need the lawyers and the judges to understand sentencing, we need the psychosocial support, we also need researchers to all be around the table when we're having these conversations and designing interventions. The second thing that we'd like to see for the future as donors is more support for evidence-based drugs education and drug policy reform. I don't know how many people here ever saw the BBC documentary Street Speak Codeine, which was sort of based on Nigeria, but you see that there's a huge political economy around the use of drugs. And when you talk about who is criminalized for using drugs, how people get hooked to drugs, we see that there's really a lot of room for research. So for example, one research that we stumbled across in terms of why students in a particular university would use drugs was surprising to find that the first three reasons was first three most common reasons given for use of drugs was: one, academic challenges; two, was ignorance about the dangers of drugs, meaning that we're not talking about drug use, we're not talking about the new drugs that are coming on stream with young people. There's this silence, there's this curtain of silence around it, which does nobody any good. And third was social acceptance of the use of these drugs. So for example, using codeine, putting codeine in soft drinks has become socially accepted in a way that we wouldn't have imagined 20 years ago. So this points to the fact that we need more evidence, we need more research. What's driving people to take drugs sometimes is not just because it's criminal behavior, which is what we like to think in many communities, and which is why it's important to change the narrative. And then the third thing that as donors would like to see in terms of all stakeholders getting on board is investing in organizational development of drug user groups, which I think I talked about earlier in terms of where we spend some of our resources and where we'd like to see more resources going to. We need to find more safe spaces for people who want to change their habits, who want to give up, or who want to ease the risks that they're putting themselves at for using drugs. And we want the conversations to continue happening around people who use drugs. They should also be part of the conversations designed for future policies and future ways of dealing with drug use and harm reduction. I think that's it for me, especially women. We cannot re-emphasize that. I just want to end with a small note that for years and years, even as a teenager, it's very common. I come from Nigeria, where we talk about women in the northern part of the country, which is considered typically more traditional, more Islamic based. Stories of women who take drugs or who take alcohol, but all this is covered. You know, these are women who don't go out, they have no social life. They're inside and nobody knows what's going on in there. And that's also really important, to be able to find safe groups for these types of women who might realize that they need help, but have no way of knowing how to access that help. So I think that's it for me. Thank you.
Thank you very much, Madam Ayisha. And I've always said that as a donor, you play a very critical role going forward with these drug policies. And you have actually highlighted the progress that you have been able to chalk in supporting these policies and reforms across the region. Thank you so much for these highlights in your presentation. Now that takes us to our question and answer session. I will encourage a number of you to put in your questions in the chat box. So I will read out the questions, and our participants should feel free to respond to any of the questions that they feel comfortable with. So we have this question from Bala Daniel, and he says that the current context is more marked by repression of drug use, stigmatization, and social discrimination, and the violation of the human rights of users, which have the consequences of exclusion, insecurity, underground practices, and poor access to service of these vulnerable populations. So how do we address some of these challenges? Any of our panelists will want to respond?
Sure, I can. Okay. This is Ayisha. I mean, attempt a short response, not to take too much time. I would say that you're right. Bala's question is right. We do see a lot of repression despite the progress we've made. I think we have to be more open about it. We need to talk about it more. I would say that one place where we can discuss drug use, how people fall into it, will be in schools. It needs to be part of our curriculum, whether it's part of the health, public health, PE education curriculum, whether it's part of civics in a way, or just social responsibility. I would think that that's a good place to start, or even in terms of clubs, maybe in terms of clubs that students and from primary, secondary school can start getting involved in and have these conversations about drugs. When the documentary Sweet Sweet Codeine came out, I have a teenage son, and his school initially actually were very resistant to us showing the documentary. Their argument was that maybe these ideas are not in people's heads, in the students' heads, and then when we show them this documentary, they will suddenly know about it. And I said, no, these children know already. What they need is to feel safe about asking questions, about us as adults, as teachers, as parents, acknowledging that drugs exist, acknowledging that drug use is happening, but having these conversations in a safe space so they can ask questions and they can see what kind of damage drug use does to them, not just to them, but to their families, to their communities, and to society. So I think that's one way that we can slowly, it's a long-term process, but that's one way that I think we can achieve that.
Madam Ayisha, any of the panelists who want to add to that before we move to our next question?
Yeah, I would like to just also add, and thanks, Ayisha, for that response. I think that's a great idea. I would also like to add that there are persons who use drugs are there. There are some organized. They try to organize themselves. One of the big challenges is that most of us have not interacted with persons who use drugs as another citizen or as another human being. And I think engaging with the community and having the community spokesperson, providing safe spaces for the communities to get together to discuss their problems, and then sharing it with other stakeholders, people who control their lives. I mean, our experience has been that if judges are made to, if judges can interact directly with the person who has used drugs or who has injected drugs and now has pulled themselves out or pulled themselves out of the habit, or continues to use drugs but in a much more sensible manner and has organizational skills and is building their own organization, they are much more inclined to understand the challenges facing them. They're much more inclined to understand that an individual who uses drugs does so for many reasons, and an individual who uses drugs to criminalize that person may be the worst thing that can be done to them. So making visible the people and having the people who are users of drugs speak about their lives in a safe environment without any risk is also a critical component to make visible the challenge. I mean, that has been done in the HIV response with the sex worker community, with the MSM trans people communities, and it is very critical to do that with all the key population groups that are critical to the response. If you do not have the person at the center of the response, then it is going to be only talk and good intentions. Thank you.
Yeah.
Thank you so much, Prof.
Thank you, Maria. If I may just make an additional comment. Okay. Just in addition to what has been said, the question raised by Bala is a very important one. And I will look at it from this perspective because for so long, we've always look at, responding to drug use as a blame game on the drug user. So this has always been an issue that, the drug user himself or herself need to kind of like shake yourself up. You need to pull yourself up. You need to get out of this. And, if you look at my presentation, looking at the history and the background to which, the drug issue grew within West Africa, you will see how, weak governance system, corruption, even deficiency on the part of the state actually contributed a lot of issues, to how to the growth of the drug economy, illicit, drug economy in West Africa. So if we can begin to have a conversation that also show the fact that a lot of external factor in terms of how even the citizens are governed, in terms of provision of access to basic infrastructure and system qualitative education, impact on the use of drug as well. So it's not just an issue that is centered upon the individual, who has all the blame, like is to be blamed, but also how the leaders, the political elite also has a role to play. Then we have a better outcome. It's going to decrease stigma. We're going to understand how, the social safety net, as the destruction of the social safety net has actually made more people, especially young ones, also more vulnerable to substance use within the region. So we need to shape up the conversation in this perspective as well, so that it's not an issue that we feel, oh yeah, everything stops at the step of the drug user, but also the event, the policy, the governance system, the political structure, even corruption and other, the weakness of the state has a role to play in this issue we are talking about.
Thank you very much. I must apologize, we are really running out of time, but I would like to take this question, and I think it's directed to Mr. Adeolu. So this person, Ediomo, says, I would like us to talk about the so-called opioid crisis in Africa and resulting policies that restrict access to prescription opioids for people with comorbid substance use disorders and chronic pain. What's your take on that, Mr. Adeolu?
Yeah, thank you. I think that is also, equally interesting. If we look, for instance, the major, pharmaceutical opioid that we may be talking about here is the tramadol, which is widely and largely, consumed outside the medical or the healthcare setting in West Africa. And reading through some report recently, I saw that it was estimated that the containers of tramadol landing at the borders of Nigeria, Benin, borders within the last 2 years has actually increased by over 300%. And the question we need to ask ourselves is, who are the people in charge of this, this trade? And if you go into the community and try to assess the strength of the tramadol that is actually being used mostly, you find out that, look, it is many times even different from what is available within the clinical setting. I give an example of Nigeria. The strength of tramadol that is approved within the NAFDAC radar is between 50 milligram and 100 milligram, of strength. But when you go into the community, you see tramadol of 225 milligram, you see of 400 milligram, and you see of 500 milligram. So that tells you that even if we NAFDAC decide to stop importing tramadol or access into the country, the market will still keep thriving. So that means there are other structures beyond the healthcare system that are latched on this market. So in terms of the supply, a lot needs to be done. And this also boils down to the corruption. So if these containers are landing at the borders, there are officers, law enforcement, organs who are within the borders, who have the responsibility of keeping the borders, safe and checked it. But these things are having free access. And peradventure, we already have even clandestine laboratories within the countries, where some of these, opioids are also being produced. But when let's move to the consumer. I've done a little study among, the users of tramadol, and for a couple, you see people who also even decide to use it for legitimate use. A couple of young people who are working within the informal sector have resorted into the use of tramadol, especially those that work in areas where they have to exert so much labor and strength. And when you ask them, they tell you, look, for me to make more money in what I'm doing, I need enough strength. So I need to at least take this tramadol to be able to, maybe for instance, I have to push, a wheelbarrow, maybe 3 times in a day, but now I need to make enough money to sustain myself. I need to push up to 10. And for me to push that 10 in a day, I need extra strength to be able to do that. You see the same thing, you've seen, some farmers also trying to cultivate more, land to be more profitable and, taking use of it. So a lot of factors that is shaping this crisis. However, the appropriate response is also not just prohibition, the banning. Like, Ayisha mentioned, we need to start from the place of education. We need to educate, and people to have a better understanding, and then access to, a public health, response in terms of access to treatment if it's needed, getting the individual to be better equipped or, even need of counseling or support services. And those who are already hooked or dependent on it have access to treatment services for them to be stabilized. So this is a whole gamut that we need to respond to holistically. I know our time is, is running out, but we need to look beyond just thinking the first approach is just prohibition, but we need to look at the drivers and begin to tackle it, one after the other.
Thank you very much, Adeolu, for that. To our participants, unfortunately, we might not be able to take all the questions, but I believe this forum is not just the end. We will continue this conversation on another platform. So on that note, I will want to give our panelists the opportunity to give us their final words, just 1 minute each, to give us their final words. So I'll be starting with Adeolu, your final words to everyone here.
Thank you very much. I want to reiterate some of the comments I made at the beginning. Drug control response should be holistic. It should be multi-sectoral. We need to look beyond the narrow view of the criminal justice system and move towards engaging from a development perspective. Look at the Human Development Index, the Sustainable Development Goals and the indicators, and see how they also impact on drug policy. From this perspective, we can begin to move forward and have a better outcome rather than just looking at it from a repressive angle that has not really achieved any result over the years.
Thank you very much. Mr. Kargbo, your take home for everyone.
Yes. In fact, I just wanted to buttress some of the things my colleague has just said, especially when he was talking about the tramadol issue. Some of the reasons why we also conducted a similar study here, and some of the reasons why, school-going kids were taking tramadol. Some for example, it was to do with increasing their sexual libido. Farmers also, it was to do with giving them extra energy to do farming. So basically the problems are the same. I think at the end of the day, it's how we tackle them, and for us to succeed, we need kind of holistic and a broad-based approach. Some law enforcement also is crucial, and also to look at it from a public health issue also, and it's how you maintain that balance. I think that's where the success will come.
Thank you very much. Prof, your message for us.
Thank you very much. I think listening to the two earlier speakers, the point comes down to adopting a holistic approach, and that is where I also want to lay the emphasis. Most often, governments adopt a simplistic approach to dealing with the drug problem, and in the end, that leads to bad policies being churned out. But in some ways, it favors politics. Bad policies, good politics. And in the end, there are some people who benefit from it, but the larger society don't. So I'm calling also for a holistic, multi-sectoral approach where we see drug as a complex problem. That is not only in the realm of law or politics, but it cuts across various areas, and all these actors should be brought on the table And it's time for Africa, Ghana, in particular, in the context of my presentation, to move beyond the criminal law approach, which is seen as an easier route, and which people see only as a means to deal with the problem, and involve a more holistic approach that I think will help solve the problem, that is going by the way of a human rights compliance, evidence-based, and public policy-oriented approach. Thank you.
Thank you so much, Prof. Dr. Saha.
Hello. There is nothing much to add. The holistic approach is the only way forward. That is for sure. I just want to emphasize it is also very critical to put the people who are who have used or inject drugs at the center, because they are not but the problem. They can help with the solution, and that is very, very critical to do. And a human rights-based approach, a holistic approach, and an approach which is not punitive and which does not punish individual people for using substances for many other reasons, for factorial, which is of multifactorial origin. It is very, very critical to put the person at the center and be very human rights sensitive to the issue. Thank you.
Thank you very much. And now lastly to my sister Ayisha, Madam Ayisha.
Thank you, Maria. Thank you, everyone. I can't emphasize too much what my other colleagues have said, so I will repeat them. We definitely need to take a human rights approach to addressing the use of drugs and harm reduction. We also need to continue to harp on and stress that we need a multi-sectoral approach. So we need more stakeholders, even more and even wider than what we have now. And finally, I'll say what no one else mentioned, but which we think is really key. We definitely need to invest in changing the narratives around drug use. We definitely need to change it. We need a more sympathetic, more understanding, more socially driven, more family focused, community focused sense of why people take drugs, why people abuse drugs, their economic, social, mental, all sorts of issues, why that happens. And we can invest in changing those narratives through what we know that our young people and even just our population are interested in: the sitcoms, our music, our pop culture, our books, our comics. We need to infuse those things in a deliberate way to help change and shape the narrative on drug use in Africa. Thank you.
Thank you very much. And this brings us to the end of this webinar. I want to really thank our panelists for making time to join us in this webinar. Despite your busy schedules, you have made time to be with us to share your great experience in this subject matter with us. And to our participants, we are very grateful for joining us. And most importantly, to the organizers of this program, UNDP, the West Africa Commission on Drugs, the Kofi Annan Foundation, the Global Commission, and the University of Ghana School of Law. We are grateful to you all. And I must say that this doesn't end the conversation. We will definitely revisit this on a different forum. Thank you so much. And I wish you all a lovely day.
Thank you so much for your time.
Thank you so much, Isabella.
much.